Good afternoon, Kalispell. I hope everybody is doing fantastic today. So, what we're going to talk about this afternoon is the difference between joint manipulation and joint mobilization. That is one of the trending topics on Google right now. So, I'm sure quite a few of you have questions on it. And these are not synonymous things as a lot of people would like to want you to believe. So, the big thing right now, the big, huge trending topic is physical therapists doing joint mobilizations, which is all fine and dandy, but it lacks specificity. So let's say when they go in and they manipulate an area, they joint mobilize, they're not making that move specific to the area of your spine that has a problem. It's more of a regional type thing. So you might get two, three, four, five bones that move at once, which, if you look at it from our standpoint, that isn't a good thing. So when you go in and you do that, you're moving things around that don't necessarily need to move. Like that's, hey, meme I posted earlier, people popping their own necks, the self manipulation. It's not good. You end up damaging the ligaments local in that area. It's really actually quite a detrimental process when you look at it from that standpoint. But when people constantly do this, they actually end up needing to continually do that, so they keep finding relief from what they have going on. And your body does have its own endogenous opioid system. So when you are popping your neck, you're actually creating hypermobility in the areas of your spine because they don't need to move, and you're forcing them to move. You get that endogenous opioid release, and then you feel better for about 20 minutes and 30 minutes, and then the pain starts to come back. What actually needs to happen in a joint manipulation, aka an adjustment, we go in, and this is where our specialized testing comes into play. We use the CLA scans, and mainly the thermal scan shows us the irritated nerves, the altered blood flow in the area. We use the EMG, and if we see the increased or decreased electrical activity in the area of the muscles, we know that area needs addressed. But that's not all. You actually have to have that single bone be fixated. So when we go in and we do an adjustment, we are just moving that bone. Back to this joint manipulation thing, especially like people popping their own neck. Really, what's going on when people get that sensation to wrench their own neck, it's likely due to an underlying problem in the neck itself, aka a subluxation. The cool things that we would do, the awesome tests that we would use to evaluate the spinal damage, would be dynamic radiographs, or dynamic x-rays as people also call them, and we would do the CLA scans. Once that's identified, if there's any abnormal curves in the area, we're going to see that. We know how to correct the abnormal curves. It does take a bit of time, but it's so worth it in the long run. So, if you guys have any questions or comments, make sure you shoot us a message and we'll do our best to get back to you as soon as we can. Have a great day, Kalispell.